shared interest that we have to secure that the situation in the country is safe.
Kenya Medical Practitioners and Dentists Union has issued a 7-day strike notice. We now bring in Ibrahim Karanja with the details. Ibrahim, good afternoon. One more, can you tell us about this strike notice?
Well, good afternoon, Ashley. The strike notice affects Kirinyaga County. This, of course, after the series of light that was shed on this particular county and the health sector in this particular county, and in particular the Kirinyaga County Referral Hospital that has made the headlines in the past few days over the sanitation of that particular place. And health workers in this particular area have now officially issued a 7-day strike notice, after which they will embark on a county-wide strike where all health workers, doctors, nurses, clinical officers, and even medical laboratory officers will embark on this particular strike, even as they champion for several things they want addressed by the county government of Kirinyaga County. I am joined by officials of the unions, that is the Kenya Medical Practitioners and Dentists Union Central Region, Secretary General Dr. Gorgudi, and also the Secretary General of the Kenya National Union of Nurses, Kainan, here in Kirinyaga County, and they'll be telling us exactly what they want addressed. And the key question that I want them to address, Ashley, is whether they have officially served Kirinyaga County government with a strike notice. And I'll start with you, Dr. Gore. Has Kirinyaga County government received the strike notice so far?
Yes, they have. They have received the strike notice that has been signed by all the secretary generals of all the unions that you have mentioned. Yes.
What are some of the things you want addressed? We have seen last week the Secretary General, National Secretary General of the Kenya Medical Practitioners and Dentists Union, Oma Oluga, was here, and he said that indeed they will issue a strike notice today. But what are some of the issues that the doctors want addressed?
We want promotions for our members. There are consultants who have been working in the county for over 15 years. They have not received their promotions. We have medical officers, pharmacists and dentists who have also not received their promotions. And as you remember, we had the big strike in 2017, the doctor strike. And a return to work formula was signed where all doctors should be redesignated to their right job group so that they can be promoted. That has not been done yet. We have consultants working at the job groups of junior doctors. We also want the issue of staffing mentioned. We do not have enough staff. For example, the Kirinyaga Level 4 hospital should have at least 40 to 50 medical officers. There are only 17 medical officers. We have a problem, and that understaffing comes with overworking and demotivation of doctors. We also have our souls. We have injury to our souls because we have to choose between two patients who have an emergency. Because of the understaffing, the patients are not getting the right care they should. Who takes care of us psychologically? And the government has not done anything to address that. As you have seen in their budget, they have 0 shillings to curative health care. There is nothing to do with employees' welfare, and that's the same thing that you have seen in the lab. The labs are very small. They are saying they're the size of kiosks. Fumes come out of there. Things like TB and HIV is tested there, and yet those doctors do not have, those officers do not have the security measures that should be applied to every lab. We are also looking for training. The county is not training anyone on either promotional courses or courses that can assist them in providing better services, capacity building, or even postgraduate training. Yet all these things have been enshrined in the civil servant scheme of service. We also want the trained casual laborers, and this is very important, to be reinstated. These casual laborers are trained not only to protect themselves, but to protect the doctors, to protect the other health workers and community at large. Currently, the workers that are in the hospital, they are pouring water that has cleaned the labs, they have cleaned the casualty, they have cleaned the wards that are full of filth. They have hepatitis, TB, HIV. That water is poured on the ground. On the ground, patients that sit and enjoy and bask in the sun, they are going to get sick from those grounds. So we are saying that Kirinyaga County is sick, and we must change that.
So, Dr. Ari, you are issuing this strike notice at the height of the bad light that was on Kirinyaga County Referral Hospital. Does the situation at Kirinyaga County Referral Hospital have anything to do with this strike notice, or is it that you had to wait until something happens to Kirinyaga County before now bringing in this particular notice?
We have been trying to talk to the county government severally. We've written letters severally. We have tried to do the diplomatic way, but we have only been met with intimidation and threats. Now that the country can actually see what we have been fighting for in Kirinyaga and ignored, we feel like it is our chance to actually show Kenyans what we have been fighting for. For the past 6 months, we have been actively trying to follow up on the county to come and see how the hospital is functioning, the understaffing, even the medical superintendent, and I'll show you those letters very soon. He has written several letters to the county to provide funding to run the hospital smoothly, but it has not been happening. I think what has happened is firing of the casual was the straw that broke the camel's back. We could no longer continue working in conditions that were continuously worsening, and promises of making it better were not met.
Question, Dr. Last week, the Secretary General, Dr. Uma Oluga, issued or told health workers at Kirinyaga County Referral Hospital in particular to leave the facility and not attend to any more patients. But a spot check done by KTN News on Saturday saw that actually witnessed that doctors had defied the orders of the Secretary General. Do you think probably they will honor this particular order this time?
The doctors were intimidated, and now they are no longer intimidated because we have come in unity. Doctors will adhere to the strike notice. They needed a proper strike notice issued, and we have issued. And even we want to assure them that according to the board recommendation, the Kenya Medical Practitioners and Dentist Board that is recognized in this country has told them to leave the hospital, so they should leave the hospitals.
Very briefly, I'll bring you for the Nurses Union. Very, very briefly, you'll allow me. Tell us, the sentiments shared by the doctors, is it the same sentiments shared by the nurses? Start with your name and official position.
I'm Regina Karige. I'm the branch secretary, Kirinyaga Union, Kenya National Union of Nurses. The sentiment, I just want to echo the sentiment that Dr. Gore has raised. They cut across. They cut across, and you know, the relationship, the way we work in health, it is a symbiotic relationship. We need a doctor, we need a nurse, we need a clinician, we need a lab technologist. So when the doctor is affected up there, it streams down to the nurses. So so the service delivery is definitely affected. The demotivation of our members, the stagnation in the same job groups, the understaffing, it is cutting across. Yeah.
Thank you. Well, Ashley, you have had the doctors and the nurses. Also joining this particular strike are the clinical officers and the medical laboratory officers. Remember, it is a strike notice. In the letter that we have seen, a strike notice written through a joint letter with the four unions. That is the Kenya Medical Practitioners and Dentists Union, the Nurses Union, the medical laboratory officers, and the clinical officers have issued this strike notice for 7 days. After which they all say they will down their tools here in Kirinyaga County, and definitely health in this particular county will be paralyzed. We will be seeking to speak to the county government officials and get to know what their position is on this particular matter. But Ashley, as is very, very tough times coming up ahead for the health sector here in Kirinyaga County. Ashley.
All right.